You've got questions? She's got answers. It's Ask Nurse Lisa.
Hey, welcome to my office. It's Nurse Lisa here, and I want to thank everyone for sending in their questions. This is getting very, very exciting. We have a lot of stuff to talk about. A couple of weeks, I'll be going to Bethesda, Maryland, to the National Institutes of Health to participate in a study, so I'm really excited about that. In the meantime, I'm getting my beginning show off the ground, and you guys have sent in some very, very interesting questions. So let's get right to it with our viewer question of the week.
Hi, Nurse Lisa. I have a question for you. I've been told that taking an aspirin every day is a good idea. How does an aspirin help? Also, should everybody be taking an aspirin every day? Or is it just when you reach a certain age?
That is a really great question, a very relevant question, as guidelines have been updated recently concerning daily aspirin regimens. The first thing that I want to talk about on this very important topic is, yes, aspirin is an over-the-counter medication, but just because a medication is an over-the-counter medication does not mean that it does not come without very serious risks. So before you start any medication of any kind for any condition, do your research. Understand the benefits and the risks. Understand everything that you can figure out about your medication. The information is there for you. Aspirin, of course, is used to treat inflammation, is used to treat fever, and it has the side effect of reducing clotting in the blood. So, because two main factors, inflammation and clots, can contribute to a heart attack, that is why aspirin is used in daily regimens. But exactly who should it be used for? Well, let's look at the current guidelines. The guidelines differ regarding your age, your sex, your medical conditions. Men aged 45 to 79 with heart risk factor should take aspirin if the preventative benefits outweigh the risks, such as bleeding. At-risk women aged 55 to 79 should take aspirin if the odds of reducing a first stroke outweigh the chances of bleeding and other complications. Men under 45 and women under 55 who have never had a heart attack or stroke should not take aspirin for prevention. At this time, those over 80 years old, it is very unclear whether it is safe enough for those people in that age group to take aspirin on a daily basis. I hope that answered your question. Please be advised to read all instructions on over-the-counter medications very, very carefully. Always watch and make sure that your medications are not outdated. If you have a history of alcohol use, talk with your doctor.
Thanks, Nurse Lisa. You've been a great help. I think I'll take an aspirin right now. Oh, orally? Oh, I'm sorry. Oh, I better go wash it off first. Thanks, Nurse Lisa.
It looks like I'm going to have to do a later show on medication administration. So now it's time for your questions. So send it in to Ask Nurse Lisa at asknurselisa@yahoo.com, and I will see you next week. Until then, be happy